I thought at this one I might talk for a minute just about how we got to this point and how we all got to be sitting here in this room, because House Bill 311 didn't just come out of nowhere, and it's not magic or coincidence that it came out at this time. The real genesis of the plan was back in 2004 when Illinois passed the Adequate Healthcare Justice Act. That's what it was. The Healthcare Justice Act, which created the Adequate Healthcare Task Force. Now, the name of that group tells you a lot about how ambitious the expectations were for it. It wasn't the perfect healthcare task force. It wasn't even the pretty good healthcare task force. It was the Adequate Healthcare Task Force. But the idea behind this bill was that it was going to create this panel of healthcare poobahs who were going to travel around the state. They were going to take testimony from the citizens, hear what their problems were, what everyday people were facing when they confront the healthcare system, and then formulate a plan to address those problems. And they were going to create a plan as a result of that, and that was going to be the big healthcare reform push in Illinois. Well, as you might expect, very soon after this was announced, the representatives of the insurance and the drug companies and the other medical industries pushed vigorously to get placement on this panel, and they did. This wasn't just the representatives of the insurance industries. The lobbyists for the insurance companies were on the panel. There were a few good ones, including my boss, Dr. Quentin Young. The panel traveled all over the state. It went to every congressional district, and it held hearings. And I didn't go to all of them, but I went to most of them. And at every single one, remember the first one was at the now famous Trinity Church in Chicago, and a couple people who are here now were there, but it was packed to the rafters, and Tom Wilson, who's not here right now, was the first person during the process to say what Illinois really needs is a comprehensive single-payer platform. And the entire church erupted in applause, and I can say that everywhere I went it was the same. The citizens got up and said, we want comprehensive, universal, single-payer health care to this panel. So, the panel only was going to evaluate plans that were submitted to it. They hired this big, white shoe, fancy consultants called Navigant Consulting. If you ever go down to O'Hare and look over the stairs, you'll see their billboard. They're this big international financial consulting firm. And so we, by which I mean myself and Dr. Ida Hollander, whose brilliance and modesty cannot be overstated, conceived of a single-payer plan for Illinois and wrote up the specifications for it, which eventually became House Bill 311. And we submitted it to Navigant Consulting, the big, fancy, white shoe firm that does these cost projections. And they went back and they took, a month, and they costed everything out, and they looked at the standards that were supposed to be evaluated, that were set up in the law establishing the Adequate Healthcare Task Force. And they came back and they said that of 8 plans submitted, single payer was far and away the best one. It was ranked higher than any other plan, and not by a little bit, by 10 to 15 points more than out of 100 than any other plan. So the next meeting, immediately the majority, which was constituted by insurance company people and representatives of the drug companies and medical industry, their first action at the next meeting was to move to table the single payer plan. It was taken immediately off the table. So the Adequate Healthcare Task Force went out, talked to all the citizens, spent a ton of money traveling all over the state. The citizens said they wanted single payer. Spent a ton of money. I think it was $1 million in this consultant. The consultant says single payer is the best plan, and the first thing they do is take single payer off the table. So we say, well, that's kind of what we expected. And they went on to say, combine all the other 7 plans into a hybrid plan, and that's going to be the thing for Illinois. So we knew, the single-payer supporters at this point, that the plan that came out of this was going to be totally ridiculous. And we need a bill to be the alternative to this. The hybrid plan, the conglomeration of the other 7 plans, turned out to be what became Rob Blagojevich's plan. And we said we need to have a bill. And that was the point at which we went to Mary Flowers, myself and Dr. Quinn Young. And we were hesitant to do it, and we were nervous to confront a legislator about it, because single payer, while we don't think it's radical, seems very much like a huge change to people who don't think of it as, well, we already have a Medicare system. And we approached Representative Flowers, and we approached her cautiously, and this shows our lack of insight. And we said, well, Representative Flowers, what we really need is we need to get rid of the insurance companies. You know, we don't need to regulate them. We don't need to change the financing structure. We need to get rid of them entirely. And you know what she said? Representative Flowers said, I know. I know. To our great surprise, she said, I know. Because Representative Flowers is unique among state legislators. I was, for 4 years, the Senior Research Associate at the Center for National Health Program, which is a national organization of 14,000 American physicians that supports single payer. And I was their sole program staffer. And so I would go to states all over the country and interact with legislators. And the thing about state legislators is they have a real short shelf life in most cases, right? They're on their way to higher office, they go off to do something else, and so once they've made all their mistakes in health reform, they're gone and a new batch has come in and they repeat the same mistakes over and over and over again. And this has happened in state after state after state after state. Representative Flowers, by contrast, told me the first time we met, looking at me like, why are you trying to tell me this? I already know it. Said, I was around in the 80s when we thought the HMOs were going to solve everything. We were going to manage care. We were going to have people with primary care physicians. We were going to save money. We weren't going to have a disorganized care system, and now I know it doesn't work. So she was way ahead of the curve. And we introduced House Bill 311, and Mary Flowers made sure that it was introduced. She got us in front of the Democratic caucus for 2 hours. We talked about just about single payer, nothing else. She got it voted out of committee favorably, so that's in front of the entire House of Representatives now. And on top of that, these hearings are not my idea. They're not anyone else in Healthcare for All Illinois or any other group's idea. They're Mary Flowers' idea. She said it's time to take this to the people. And to tell you the truth, I was a little bit hesitant. Because I said we did this 4 years ago. We went around, we talked about it. We brought people out. We thought we had single payer. We didn't do it. And now I realize that the difference is that this time it's about us. Last time, it was about the drug companies and the insurance companies and present company excluded, the politicians. This time, it's about the patients who can't get access to health care whether or not they have insurance. This time, it's about the business owners in Illinois who have to choose between providing health care for their workers and being in the red. This time it's for the taxpayers who have to give up other essential public services because insurance companies take a 1/3 cut of all our health spending. This time it's about us and not about them, and that's what Mary Flowers has contributed to this, and she really deserves a round of applause for that.